Welcome to the Pin Leader Podcast, where strategic leaders get straight to the topics, strengthening our awareness and sharpening our minds. The Pin Leader Podcast is produced by Roar, a production division of Mays & Associates Ltd. Find out more at www.maysassociatesltd.com. Now here is your award-winning host, Dr. Shanda Gore.
And welcome to the Pin Leader Podcast. Today we're going to be talking about knowing the blind spots. And I have with me Mr. Jason Abodeely, who is the president and CEO of Sunshine Communities. He has a wide variety of professional experiences and has provided a wealth of growth opportunities, both domestic and abroad. He has spent 8 years with IBM, including application development, marketing, business development, international alliance sales, as well as direct sales and sales management. He served as a director of global channel direct sales for VeriSign, and just before his tenure at Sunshine Communities, he served as vice president of operations for Evolve, a software company based in San Francisco, specialized in predictive analytics. And when he started his tenure with Sunshine Communities, he was the chief operating officer, and now he is the president. So I'm very excited to talk to Jason and welcome him. Welcome, Jason.
Well, thank you.
So the first thing I'm going to talk about is knowing the blind spots in this episode, which, just having a conversation with you about being self-aware, knowing that, can you explain a little bit of what that means?
Yeah, I've learned a lot, I think, over the career. As I've grown, as I've met different leaders, that knowing your blind spots is a bit of a misnomer. In the definition of itself, you really don't know your blind spots. That's why they're called blind spots. And you need to surround yourself with people that you trust and trust you so they can identify those. We all have blind spots. Every single one of us repeat patterns that we don't necessarily see or notice because we're in our own echo chamber, if you will. I think having trusted people to identify what those are is probably the most critical piece to growth professionally that I've seen.
Mm-hmm. I think that one thing you talk about is team building and having that opportunity to really cultivate a team, and then that team to be able to have that ability to talk with you about the blind spots. Can you talk a little bit about your advocacy? Because that's another piece of blind spotting that you do with helping others.
Yeah, it does go bidirectionally. Advocacy for people with disabilities, developmental disabilities across not just Northwest Ohio, but across the state. It's become my life. It's become part of who I am. And even in that, even in doing what I would call good work for all the right reasons, you can develop blind spots and you can develop patterns where building that team to remind you of the opportunity to have scope creep come in and push you to the side or push you off your intended target is so critically important. That trust builds over time. You don't just come into an organization and all of a sudden, hey, everybody trusts you and they're going to tell you exactly how they feel. So building that team takes time, but once it's built, I think that bidirectional trust is what kind of all boats rise together when that happens.
Mm-hmm. And you're talking about with your team, you help them with their blind spots, I would think.
Yeah, and in a weird way, there is, a method to the madness when you try to help people grow, both as a person and as a professional. I'm pretty much hanging my hat on a career where I care about the person outside of the workplace as well. And so when you identify blind spots, you don't just come out and say, XYZ, here's what you're doing wrong. It's the sandwich. We've all learned the sandwich, right? It's some type of compliment. It's, hey, I've noticed this, that, and the other, and it's not a big deal. We're gonna work on this together, end with something positive, and you move on. And the more you do that, and the more you give people grace, and you appreciate the things they're doing right, not just identifying what they're doing wrong, they start to wear down their fear of telling you the same thing. Mm-hmm. And it doesn't matter if you give them the right to dissent. It doesn't matter if you say, listen, I need your true feedback on my performance, on my execution, etc. That title, that position, people have an inherent fear until that wall's broken down.
I agree. What in your experiences, because you've had so many, has really helped you lead an organization like this one?
I've had that question on several different occasions. In one aspect, almost nothing about my professional past prepared me for this experience. I was traveling the world. I was in for-profit technology, never had an office in my career in a weird way when I think back to it. And now I find myself co-leading an organization that's faith-based, nonprofit, local, and in health and human services. It is diametrically opposed to, on the opposite side of everything that I've ever done. But in a way, I think it prepared me to bring different perspective. The health and human services field, specifically developmental disabilities, but you could go to long-term care and others, have long fought the indirect cost battle, if you will. How do you attract talent with minimal resources when you are operating in an inefficient model? And I think my experiences in the past with for-profit models and cost structures and things of that nature has really helped bring a different perspective that we can treat our employees better, not just pay them more, hire a different level of employee with greater empathy, and do so by cutting out just the unneeded costs that are in a system that is not quite as archaic as it used to be, but still is a little bit behind the times.
Do you find that recruitment and retention of a talent workforce, have you found it challenging, and especially working with populations that, again, may not be able to advocate for themselves?
It is. It's probably the number, I won't even say probably, I'm going to take that back. It is the most difficult thing that we do. It's not just finding talent and people that are willing to serve a mission and assist people with developmental disabilities to live their most optimal life, but keeping them and understanding that their lives matter too outside of work, and how do we support them with the challenges that they have. If you imagine running a business where there is no control of revenue, you don't make anything, you don't sell anything, you don't control pricing, what can you do to make the lives of people better? And how do you attract talent to come in and join your mission? And that's what we do. Our product is people.
I was going to say your reach, even though you say local, is much broader than that. Can you talk about that mission for Sunshine Communities and the different components that you work on?
Yeah, so when you talk about creating community for people with developmental disabilities, in our mission, it extends to family, friends, and the greater community. And so while we may touch the lives of 300 people in any given day, and we may have close to 500 employees, we also have over 2,000 volunteers every year, 20,000 volunteer hours every year. We have multiple events that bring in the community and touch lives. And so understanding who your constituents are, I think one of the places that Sunshine thrives in Northwest Ohio, because while we focus mostly on Northwest Ohio, we are supporting people all over the state. So when we admit someone, whether it be residentially or otherwise, our ecosystem, if you will, of need is anywhere in the state. So often we may find an infant at a children's hospital in Cincinnati. We become part of their home and part of their life, and so do their families. So it's a greater responsibility than a couple square miles around Maumee, Ohio.
It sounds like it. Now, because we have listeners in different states and in different countries, can you talk about where you might see these services replicated if someone were to seek out? Perhaps they're leading the care of an individual that they are guardian over, or they're helping give advisement and a leader in the healthcare of somebody else that just does not know where to go or find information, or maybe it's personal. You know, where would you find a Sunshine community in other states? How do you go about doing that?
Yeah, one of the first resources I would tap would be your state government. So every state has a department, if you will, of developmental disabilities. And because it's a Medicaid-funded resource, every state has different Medicaid rules. And that's the uniqueness around Medicaid and in the system, is that every state's going to run a little bit more unique, if you will. That being said, they all have resources available. I think you hit on a point that we are running into now with a new generation of parents who aren't really necessarily aware that what they're doing is noble, in the sense that they're trying to do everything for their child. And I think children and adults, quite honestly, with developmental disabilities are more often than not, for all the right reasons, living independent lives, staying at home, etc. But sometimes it's because parents don't realize that our system exists. And whether it be a call to the county board of developmental disabilities in states that have county boards like we do in Ohio, or to the state, there is a system in place, and there are systems of support that exist that aren't taken advantage of often. Because while we're unique in the state of Ohio, the system is not unique across the United States.
Mm-hmm. I think some of the pieces when I was doing research on Sunshine Communities is that ventilator discussion, because not everyone does a ventilator, for example, for those with disabilities, but you do.
We do, yeah. We're the only organization in Northwest Ohio that provides extreme high medical ventilator care to both infants, children, and adults, if you will, who have that need. There are 5 of us in the state of Ohio who do that. Let's say, for lack of a better number, there are 5,000 providers in the state. So it is a select few, and this is a specialty that we pride ourselves on. And we have a large nursing and clinical staff that assists with that, and it's something that we're looking to grow because we see the needs growing across the state with children being born into hospitals, and quite honestly, that's not where any human being deserves to grow up.
Mm-hmm. When you talk about a growth in numbers, can you speak to that? What are you seeing? Like, is it 5% a year, 10% a year?
Yeah, it's hard to put a number on the growth, if you will. We're seeing a greater need. I think what we're actually seeing is a greater awareness. And I think because the awareness is becoming more evident to state leaders, to pediatric hospitals around the state, specifically in Ohio, their awareness that we exist has changed our awareness of how great the need is. And I think that's really the paradigm shift. I think the need was always there, but we have to do a better job of, marketing's the wrong word, but really telling people who we are and what we do and what we can do for the greater community, specifically for people that have support needs.
Yeah, with the opportunity to talk to other leaders, what suggestions or advisement would you give those that are helping lead other populations like this within organizations? You know, what have you learned over your many years of experience and your varied experience background?
Well, with respect to the leaders of the organizations, I think you have to take yourself out of the equation when you consider what I'm about to say, because if you are self-aware, you can admit that your position multiplied by X is not necessarily needed. How many CFOs, CEOs, heads of human resources, chief operating officers do we need to run this many organizations? So tax dollars have a limit. There's a ceiling, and there's only so much money to go around. And ultimately, whether you're in long-term care, mental health, developmental disabilities, you name it, Health and Human Services has an indirect cost problem. And I saw this within the first few years I was with Sunshine. The money needs to be put in the hands of people doing what I would consider God's work, the hardest work that's there, and that's giving direct care, whether they be nurses, clinicians, direct support, etc. What I'm starting to see is finally a trend that you could see coming a decade ago, which is organizations starting to affiliate. And I'm not talking necessarily merger and acquisition like for-profits do, but affiliate and trying to take out cost so that the overall life, if you will, of those who we are trying to recruit and keep is enhanced. And by definition, then that leads to better care and more people getting care. Because ultimately, we can give great care to 100 people with disabilities and pay people a lot of money. But why wouldn't we try to do the same thing for 500 people? And the need is out there. There's an unlimited amount of need. We just have to figure out how to get the employees in, treat them the right way, teach them the right way, and impact more lives.
You know, that leads to a very important point about demonstrating and showing care. You know, I do so much discussions around how to recruit and retain good talent, and it's not really about the money in many instances. Of course, it has some play in that, of course, and some might be their main focus. But in others, it really is about the engagement. How am I part of the team? Am I helping grow the whole boat forward together as a team? Am I included? Am I listened to? And so it's very important as a leader to make sure that those components are in place. And I think you said something very important about that direct care with those that, again, may not say back to you, thank you so much. I so appreciate you helping me today because of a disability. Just knowing that you're doing the work, sometimes it has to be enough. So let me talk to you about some of the accomplishments. And you know, what would you say is your most prized accomplishment after doing all this work?
That's a very deep and wide question. If it's in totality of my life, I'd say it's being a father, 3 children, 4 stepchildren, very involved. I think the decision to throw my life into Sunshine's mission had multiple benefits. I think Sunshine is in a better place for having the leadership team that I've been able to feel fortunate enough to build, but I was able to be the best version of a father that I could be. We can talk about how we not only survived the pandemic, but we actually led a lot of organizations in and out of it. We can talk about how we've more than doubled wages for the direct line caregivers. We can talk about a lot of things over the last 11 years, but ultimately, I'm going to hang my hat on the fact that I've got relationships with 7 children between the ages of 12 and 22 that are all strong in their own unique ways, but they continue to get stronger, and I think that's probably my biggest accomplishment.
So when you're not working and pouring your life's work, what are you doing to relax? What are you reading? What are you watching?
Well, don't watch a lot of TV. Haven't in years. I'm going to go back to the comment on children. They don't necessarily allow you to watch a lot of TV, but my wife and I
true.
do. Yeah, my wife and I do take in Suits. I know it's a 9-year series, but one episode every week has got us through season 3. So don't tell me anything.
Okay.
Outside of that, as far as books go, I'm an interesting book reader. I take books and I summarize. I skim. I've never been one. You talk about blind spots. This was not a blind spot. This was a well-known deficiency in my educational career. I'm not a great reader. Mm-hmm. I comprehend through visual, audio, experiential, but I've adjusted. And so currently, they buy your because is what I'm going through right now. Trying to understand how a for-profit methodology can be adjusted for nonprofit work. Mm-hmm. Understanding why should people choose you? Not because of your product, but necessarily from an employee standpoint. Why would someone want to come work for us? Differentiating us and simplifying that. Identifying the target audience that we might want to hire, but then connecting with them. And I think that connection is difficult before you hire them, but it's mandatory after. And so this book is helping a little bit with that.
Who's the author of that book? What's the full name and author?
Jerry O'Brien.
Jerry O'Brien, okay. Okay, and the full title again?
They Buy Your Because.
They Buy Your Because. That's a powerful title.
Yeah, it's interesting because one of the first steps is understanding people's why, which was a book that I just previously went through with Simon Sinek. So
yes,
it all does connect.
Mm-hmm. Yeah, if you can get to your why, many of the other pieces will fall in place.
Sure.
In purpose and mission, vision. So excellent. Well, I can't thank you enough for coming on the show today and sharing your experiences and, and talking through some of the population, some of the challenges that occurs, and then giving some advisement for leaders who, again, may have their own blind spots and may need a team to help them, and how very important that is.
Doctor, I absolutely have loved my time with you. I loved the first time we met. Big fan of your work. And if I close with anything on the concept of blind spots is to welcome them. Surround yourself with people who identify them and don't feel like you need to fix them. You can't fill every gap. Sometimes hiring the people to fill your blind spot is the best way forward to build a stronger team.
Excellent. That's great advisement, because we can actually never get a hold of all the blind spots. And we're human, and that's great advisement. Thank you.
Thank you.
And thank you to our listeners who have taken in the show and are sharing it with others. We really appreciate the time that you're putting into that. And again, don't forget to sign up for the newsletter that's coming out here real soon at info@Mays Associates Ltd. Also, make sure you're signed up for the new book and on the wait list under www.maysassociatesltd.com. And of course, until next time.
The Pen Leader podcast is hosted by Dr. Shanda Gore and brought to you by Mays & Associates Ltd., creating customized solutions for growth in the areas of leadership development, strategic planning, and culture building. Find out more at www.maysassociatesltd.com. Don't forget to subscribe to the Pen Leader podcast and share with others.